Good morning, and thank you for joining us for today's news conference. We're here today to talk about how we're addressing one of the most critical challenges our community faces, which is ensuring mental health support is available when it's needed most. With me this morning are Lincoln Police Department Morrow, Lincoln Police Department Captain Baird, Centerpoint Executive Vice President and Chief Operating Officer Tammy Lewis-Arendt, Lincoln City Council member Sandra Washington, and Malone Center Executive Director John Goodwin. To become the safest and healthiest capital city in America, the City of Lincoln is committed to utilizing a nuanced and comprehensive approach to ensure the safety of all of our community members, and particularly those with mental health needs. As evidence of this commitment, you can look at our track record. Our behavioral health unit within the Lincoln Police Department previously joined forces with Centerpoint to create the Alternate Response Program to better serve our unsheltered community members. We recently became the first city in Nebraska to establish a 911-988 partnership, which connects individuals in a mental health crisis to licensed crisis counselors at the National 988 Lifeline. And for years, we have enjoyed a long-standing relationship with the Mental Health Association of Nebraska, whose peer specialists have supported community members in their time of need at the request of our LPD officers. Building on these successes, we are excited to announce progress in our additional strategy, the Co-Responder Program, that we are developing within the Lincoln Police Department. Today, we want to share with you the next milestone in the development of the Co-Responder Program. Following an RFP process, LPD has selected Centerpoint to provide the co-response with LPD officers. So from a big picture perspective, here's what it will look like. The City of Lincoln's co-responder program will partner Centerpoint's behavioral health professionals with our police officers to respond jointly to mental health incidents, ensuring that when our residents face a mental health crisis, they receive immediate and specialized care. And this approach enhances public safety and provides vital mental health support in real time. I want to thank again our partners at the U.S. Department of Justice Bureau of Justice Assistance for last year awarding $550,000 in federal funds to LPD to support Lincoln's co-responder program. And I also want to thank the members of our police department whose hard work, performance, and dedication helped us to earn this opportunity. So now here to share more details about our co-responder program and how it will benefit both our community members and our officers is our Lincoln Police Department Chief, Michon Morrow. Chief Morrow?
Thank you. Thank you, Mayor. Good morning, everyone. I'm so excited to be here in front of you today. There are first a few people that I need to express my sincere gratitude for. First being Captain Ben, who is the lead within our mental health behavioral health unit. Also here today we have Investigator Doug Headley, who works with the mental health unit. And then we mentioned the alternate response, and we have Investigator Melissa Ripley here as well, who also works within that unit and working with those that experience mental health concerns and struggles within our community. The tireless dedication within our behavioral health unit is a testament to the commitment to understanding and addressing the challenges our community members face every day as LPD strives to serve the whole of a person. When developing the co-responder program, it was crucial for us to guarantee that mental health professionals involved were not just qualified, but deeply experienced and compassionate. That's why we have prioritized bringing board master level clinicians, licensed clinical social workers, and licensed independent mental health professionals to join the Centerpoint team and work alongside our officers on the street, responding to calls for service with those needing us with the care and expertise that they deserve. This new partnership builds on the effectiveness of existing mobile crisis teams and peer support specialists that we have worked with for years. It strengthens our efforts as we will create a dedicated unit of licensed mental health professionals that co-respond with LPD to calls for service. This builds greater relationships between those licensed mental health professionals and our officers and increases the timeliness of the response to them. According to research reviewed by the International Associations of Chiefs of Police and the University of Cincinnati Center for Police Research and Policy, co-responder programs lead to better outcomes. They reduce the use of control by officers, decrease future contacts with callers, and provide quicker access to the help people need. In summary, they're successful. The initial 3 years of our co-responder program are funded by the $550,000 BJA grant. It also has a match of $221,278. That's from the city's budgeted general fund. Nearly 85% of the funds will pay for the co-responder salaries. The rest, the majority of those remaining funds, are to provide the necessary training for our co-responders, work with the Michon Center to collect community feedback regarding police response to mental health calls for service, and work by Dr. Richard Weiner and researchers at UNL's Department of Psychology to evaluate the effectiveness of our program. The implementation of the program in Lincoln speaks truly to the core values of our department, values that emphasize preservation of life, the importance of problem solving both within our ranks, within our organization, and in our community, crime prevention, providing safety for all those in the community that we serve, and above all, human dignity. At the heart of it, our goal is really to meet people where they are and provide them the support they need, whether that's law enforcement intervention, mental health care, or simply ensuring that they have the basic needs to live with dignity. The growth of these partnerships allow us to broaden our focus, ensuring we are not just addressing criminal behavior, but are also nurturing the well-being of our entire community. Thank you. Mayor?
Thank you, Chief. LPD Captain Ben Kopsa leads the Behavioral Health Unit and has played an integral role in LPD's crisis response innovations, including the development of our co-responder program. And now I'd like to ask him to join us and talk more about the program's future implementation and what it will look like on the ground. Captain Kopsa?
Thank you, Mayor. Good morning. Today's announcement reflects the progress made over the last 4 years while acknowledging that we still have work to accomplish. LPD has a long-standing history of appropriate and compassionate response to mental health. This includes academy training and developing a training program with our partners at Region 5 Systems, as well as collaborating with entities like Centerpoint, Bryan Health, and the Mental Health Association of Nebraska. In 2020, LPD created the Mental Health Coordinator role. Our commitment to expanding access to mental health care continues to grow. This spring, we began tracking how often mental health plays a role in each of our calls for service. Since May 1st, over 5,000 of the nearly 47,000 calls officers responded to were mental health related. Officers make this determination on scene when they believe the mental health condition of a person directly involved caused or contributed to the incident. We understand that people default to calling 911 when they need help, whether it's a public safety concern or a mental health crisis, so we strive to offer the appropriate support tailored to their needs. Through the co-responder program, mental health professionals will have police radios, allowing them to monitor calls for service as they are dispatched. They will travel separately from officers, giving them more flexibility to respond to and remain on a scene as needed. This approach will allow the clinicians to maximize availability across the city, as they will not be limited to a single police cruiser or a geographic area during their shifts. There will be several ways a mental health expert can be assigned to co-respond to a call. Officers may request their assistance upon arrival to a call if they determine additional support is needed. The clinicians can decide to respond based on radio traffic, case information, familiarity with the person involved, and then they'll wait for officers to secure the scene before entering and ensuring their safety. And then our 911 telecommunicators can also dispatch them based on the initial details provided by a caller. Our vision is for these professionals to be active in the field as much as they are needed on a call, while also doing community engagement when they are not on a call to get feedback that informs their work and builds relationships with both officers and the community. We will be holding community conversations that will allow us to hear from people who have personally experienced interactions with police during a mental health crisis or know a loved one who has, so we can get feedback directly from those we serve. Together, we're working to create a safer, more compassionate city where everyone receives the care and support they need. Thank you.
Thank you so much for your leadership, Captain Kopsa. We appreciate your service. For decades, Centerpoint has helped Lincoln be a community that supports the well-being of every resident. And I'd now like to invite up CenterPoint Executive Vice President and Chief Operating Officer Tammy Lewis Arendt to share more about how CenterPoint will partner with the Lincoln Police Department to carry out the co-responder program. And Tammy, I just want to say thank you as well for your leadership, for all of the partnership that we enjoy with CenterPoint.
Thank you, Mayor Gaylor Baird. Thank you, LPD Chief Morrow and Captain Kopsa, for your collaboration and innovation on this project. I also want to express my gratitude to CenterPoint staff, specifically Amber Dirks, Senior Director of Community Response, and Ryan Carruthers, our Chief Clinical Officer, for your leadership and work on this program. CenterPoint helps people get better sooner for longer. Last year, we served 5,000 individuals, over 5,000 individuals, the largest number in our 51 years of operation. The need for behavioral health interventions, especially those like this program, is significant. We're proud to partner with the city and continue to develop and provide innovative solutions to better meet the needs of our community. Our crisis intervention experience is extensive, with over 6,400 community response contacts this year through our mobile crisis response program and our current partnership ventures with LPD, including Street Outreach Alternate Response, Link Point, and Square One. We're looking forward to expanding these partnerships to include the co-responder program. We envision the co-responder program as a vital collaborative effort that leverages our expertise and complements the work of law enforcement officers. By embedding behavioral health professionals within law enforcement, we aim to de-escalate situations and connect individuals with the services that they need. CenterPoint will add 3 licensed mental health practitioners to our staff who will work side by side with law enforcement officers on calls regarding mental health and substance use crises. Because these positions will require expertise and experience, CenterPoint will work with LPD on ensuring that we've identified appropriate and qualified candidates. We expect the process of vetting and hiring could take several months. CenterPoint's crisis response team will then collaborate with the mental health practitioners in the co-responder program to provide individuals post-crisis follow-up support, ensuring comprehensive approach to addressing the diverse needs of individuals experiencing crisis. CenterPoint's mobile crisis response team provides empathetic support and guidance to individuals in a variety of situations, including those experiencing homelessness. CenterPoint is committed to upholding the highest standards of care and professionalism. We will bring our extensive experience, evidence-based practices, and dedication to person-first, trauma-informed care to this partnership. Our goal is to create a program that addresses immediate crises and fosters long-term well-being and stability for individuals in the community.
Thank you, Tammy, and thank you so much to your team at CenterPoint. You all are playing such a key role in ensuring the health and well-being of our community members. Our Lincoln City Council members are also key partners in supporting city programs and services that enhance the health and safety of our community. And I'd now like to invite up Lincoln City Council member Sandra Washington to provide her perspective on how the co-responder program will help foster an even safer, healthier Lincoln. Councilmember Washington.
Thank you, Mayor. As chair of the Lincoln City Council, my highest priority is to help ensure that everyone in our community is safe and healthy. Since taking office, it's become evident to me that our community, like many others across the country, need to demonstrate the importance of trust relationships between residents and law enforcement and to address the mental health needs of the community. I and the rest of City Council supplemented the budget by $125,000 in 2021 to increase resources available to LPD to explore options for enhancing their response to calls for service involving a mental health challenge. As we deliver on this priority, I continue to be committed to working with our community partners to craft innovative solutions to complex challenges. The co-responder program is an innovative solution to the complex challenge of mental health by integrating the expertise, background, and abilities of our dedicated law enforcement professionals at LPD with CenterPoint's mental health practitioners. We will connect our residents to the mental health care that most appropriately and effectively meets their needs. With public safety partnerships like the co-responder program, Lincoln continues to be at the forefront of compassionate, community-based policing. On behalf of the Lincoln City Council, congratulations to LPD and CenterPoint for reaching this milestone in the development of this truly important program. Thank you.
Yeah. Thank you, Councilmember Washington, and thank you to the Council for the support. The funding support is crucial to this program. All right, well, this program is another shining example of how the City of Lincoln and our community partners work together to get our residents the care they need when they need it. And through innovations like the co-responder program, we are advancing our goal of making Lincoln the safest and healthiest capital city in America. And I'm so grateful to all of the people who have put in the time, the dedication, the expertise to bring us to this moment. And with that, we'd love to open this up for any questions that the media may have.
Yeah. Could you highlight some of the main differences that are going to be between the alternate response program and this program?
Happy to do that. I'll just say broad brushstrokes. Alternate response is helping to serve the needs of the unsheltered or the people experiencing homeless specifically in our community. And co-responder may be a whole range of behavioral health needs that need to be addressed that we can tell having a licensed professional with police will provide the most appropriate comprehensive response. But to share more about the different portfolio of programs, I don't know if you or Captain Copsa would like to share more details?
Yeah, thanks for the question. The alternate response program has been a huge success. We've diverted, I think, over a few thousand calls from a police officer response to a call where there's really no criminal matter there to a more compassionate response with CPO, Centerpoint Outreach Team. And this program will be focused on those that are experiencing a mental health crisis. So that alternate response call may be somebody who's just on the sidewalk, looks like they may need assistance, and someone is concerned and calls 911. We get the Centerpoint Outreach Team out to them to provide that assistance. And this will be more so based on the mental health crisis, someone that's depressed, someone that's thinking of hurting themselves or others, and that's what this program will serve.
It was mentioned that there was going to be 3 new additional staff to help with this program. Is it going to be, are there specific hours that these 3 members are going to work?
Yeah, do you want to talk about the hours?
So we've really taken a data-driven approach to looking at this issue, and we've looked at when those calls come in. We have a great number of data collection pieces within our department that can inform us on these kinds of decisions. So looking at those calls for service, we looked at when are those calls happening the most frequently. And so it's basically between 10 a.m. and midnight. That's when we're responding to the most of these calls. And so that's when we're going to schedule these first 3 that we are going to bring online.
I know the alternate response program has like a 20-minute gap that if somebody from Centerpoint unfortunately is not able to answer that call in 20 minutes, the police will go to answer the call. Is this going to have something similar where if one of the staff members is maybe busy with another call or just not available at the moment, or is it going to be something different where they are going to wait for the Centerpoint member to be available?
So this program will still always have an officer responding, both to make that initial contact and ensure the safety of the scene. And so we'll always have that initial officer response, and we program that as a higher priority for these types of calls for service. So we'll always have somebody responding as soon as we can. If that team member is on another call for service or they're unavailable for another reason, then the officer will work through the call as they do today. So that might include calling out mobile crisis response from Centerpoint. It might include them transporting the person to the hospital for further assistance, or it could mean that we leave them there and ensure they have support and then make a referral to Mental Health Association of Nebraska or some of our other partners.
Out of curiosity, so you talk about how LPD officers are going to be there to make sure that they're for a point of contact, and clinicians will be traveling separately, correct?
Yes.
Does that mean clinicians are going to be integrated into the city's emergency communications grid, or are they going to be contacted through officers directly?
Yeah, so both in a way. Yeah, they will have police radios, so they'll be able to hear those calls coming out, but of course there's different radio channels and there's times where they're not hearing everything. So the telecommunicators can contact them directly. The officers out on a scene may contact them because we often go out on calls where initially it's not known that there's a mental health need out there. It could be a disturbance, it could be a trespassing, any number of different calls that come in. So once the officers are on scene and they make that determination, then they may request that the team members come out and meet them there.
Thank you.
Mm-hmm.
It was mentioned that UNL is gonna look at this program to evaluate its effectiveness. What exactly what exactly is going to be provided to them for them to look at, and have they looked at other programs, like for example the alternate response program, before as well?
Yeah, so we've started collecting and recording a lot of different data points that relate to our response to mental health calls. We've collected a lot of that in the past, but there's been some specific things that, because of this grant, we've started collecting. So on every call that is designated as a mental health call, we've been recording whether the person was left on scene, whether they were connected with a community resource on scene, whether they were referred out to another partner, and then if we were to transport that person somewhere, where we took that person. Did we take them to a medical facility? Did we take them to a mental health facility? Or any other number of places. And so those are the kinds of things that UNL will look at to determine both the officers that are responding without co-responders, where did those people go, were they connected, the calls that were responded to with co-responders, where did those people go? Were those people more often left at their homes, or were they more often connected to other community resources? So we're also looking at our use of control that Chief Morrow mentioned. So if there's a co-responder on scene, is there less times that officers are using control? So that would be using force in order to take someone into protective custody or to effect an arrest. So numbers of arrests that stem from these kinds of calls will be another thing that they'll be looking at and seeing if we can decrease those numbers.
Any other questions from media? All right, well, thank you so much for joining us to learn more about how the City of Lincoln and our community partners are innovating to respond to the mental health needs of our community members and ensure a safe and healthy Lincoln for everyone. I am so proud of our LPD team and so grateful for our partnership with Centerpoint and Malone Center and other communities, organizations, and individuals who care and make this such a wonderful